Hello, my name is Kelly Martinez and I'm a medical technician here at the Dermatology and Skin Cancer Office. You're in here today for basal cell carcinoma, which is a form of skin cancer that you have. Basal cell carcinoma is usually caused from exposure to sunlight, lack of sunscreen, intense use of tanning beds, and it tends to look like red sores and open wounds. Your basal cell carcinoma is located on your zygomatic bone, which is your cheekbone. Today you are in here because your dermatologist, your skin doctor, recommended Mohs surgery as your performance for removing this form of skin cancer. Mohs surgery is one of the most effective micrographic surgeries for this form of skin cancer. This surgery is done in one visit, but it is broken down into stages. The doctor, your surgeon, will be accompanied by a pathologist, which is a doctor who recommends and analyzes the study of diseases. The procedure is going to take several hours, and it starts off with your surgeon inserting local anesthesia into your cheekbone. He will then use a scalpel, which is an instrument used in surgery to open wounds. He will use a scalpel to take a layer of tissue off of your cheek. He will then take that tissue into our on-site lab, where the pathologist and the dermatologist will put the tissue under the microscope, which is an instrument used to study and see close and like cells and bacteria and all that. And in which your case, they're using the microscope to see the cancer cells. They are trying to see if the cancer is still there, because by removing the tissue, the cancer tissue, they're also removing the cancer itself. At the end of this procedure, the surgeon will then stitch you up. And as they're stitching you up, they give you some brief instructions on like taking care of your wound, making sure that you are keeping very good care of it, cleaning it right. Because with it being on your cheekbone, making sure that you're keeping the wound clean and healthy is very, very important. So after a couple of weeks, usually 9 to 14 days, so 2 weeks, you will come in for a follow-up visit. In the follow-up visit, we will check with you to see how you're doing, if you've been feeling better, if you feel like there's something else wrong. We'll ask you questions, and we'll also let you ask us questions. During this follow-up visit, you will also be getting your stitches removed. Now, I'm going to go ahead and let you know now that you will have a scar from the surgery, but with most surgery, we try to make sure it is the smallest scar possible. But there is no guarantee, but there will be some form of scar after the stitches are out and everything is healed. Now you have nothing to worry about because Mohs surgery is one of the most effective and efficient surgeries for removing this form of skin cancer in specific. So you have nothing to worry about, but if you do have any questions, you can go ahead and ask me. I'm your medical technician, and I will also be accompanying you during the procedure. And if you also want to ask questions to your dermatologist or pathologist, by all means, you can go ahead and ask them. They are available to answer any questions that you have. But other than that, if you don't have any other questions, I will go ahead and walk with you to your room. Follow me and everything will be okay.